Hi everyone, welcome back to my YouTube channel. Today we are going to talk about neonatal versus adult skull. First we will talk about size and proportions. Neonatal skull that is disproportionately large relative to the rest of the body. It is about 1/4 of total body length. In adult skull it becomes more proportionate, roughly 1/8 of body length. Second difference is number and separation of bone. In neonatal skull, it is composed of more separate bones. Many are connected by fontanelles and suture that haven't fused. In adult skull, bones have fused completely as suture, forming a raised structure. Third difference is fontanelles. In neonatal skull, it has 6 fontanelles that are soft fibrous gap between bones. Are anterior, posterior, sphenoidal, and mastoid fontanelles. So there are overall 6, one anterior, one posterior, two sphenoidal and two mastoid fontanelles. In adult skull, the fontanelles close within the first 2 years of life replaced by bone. Next difference is about the suture. In neonatal skull, sutures are wide and flexible, allowing molding during birth and postnatal brain expansion. But in adult skull, sutures are narrow and interlock fusion prevent further expansion. Next difference is about shape and curvature. In neonatal skull, shape is more rounded with a prominent forehead and underdeveloped face. In adult skull, it is more elongated or oval in shape, the skull area or the norma verticalis area, and the facial skeleton becomes more prominent. Next is facial versus cranial proportion. In neonatal skull, facial bones are small, cranial vault is much larger, about 2/3 of skull length. In adult skull, facial bones have grown significantly, vault and face are mostly proportionate. Next is about mandible and maxilla. In neonatal skull, underdeveloped mandible and maxilla are often without the teeth. But in adult skull, fully developed jaws or their mandible is stronger and houses all permanent teeth. Next is presence of paranasal sinuses. In neonatal skull, paranasal sinuses are rudimentary or absent at birth. But in adult skull, sinuses are fully developed, helping with dry suddenness and skull weight reduction. Next difference is about foramen magnum and skull bone. In neonatal skull, the foramen magnum is more anteriorly placed, accommodating a flexed neck. In adult skull, foramen magnum shifts posteriorly with spine curvature changes. Next is ossification center. In neonatal skull, many bones are still ossifying. Bones like occipital and frontal bone may be in multiple parts. In adult skull, ossification is complete bone or fused into single units. Now let's talk about conclusion of this lecture video or these differences. Neonatal skull is masterpiece of adaptability, light, flexibility, and engineered for growth and protection. While the adult skull, in contrast, it reflects completion, a stable, durable framework shaped by years of structural refinement. And this was all about the differences between neonatal skull and the adult skull. Hopefully you liked the video. If you like, don't forget to like, share, subscribe and comment. And if you want to add something, you can also do that in comment. Thank you for watching.